today on the show, we have another person here to talk to us about the very important subject of COVID vaccination, because there's a lot of hesitancy and confusion out there still. We have today Dr. Helena Swinkels. She's a medical officer at the First Nations Health Authority, here to tell us all about some very important vaccine topics, including questions that a lot of us have. Like, first off, do I actually need to get both vaccinations?
Yes, getting both vaccinations is really important. Getting one shot does provide pretty good protection, but when you have both of them, you get the strongest, best, and longest protection possible. Right now, almost all of the cases of COVID-19 in the province are in unvaccinated people. So getting, you want your immune system to be getting as much practice in learning to recognize the COVID-19 virus so that it can, start fighting as soon as possible and fight off infection. So for this, you do need the two doses.
And the second shot, what is so important about that second shot?
Well, with one shot, it sort of primes your immune system to know about, to be able to recognize the virus. But when you get that second shot, there are other parts of the immune system that are better activated, and it just lets the whole system start working much more quickly. And it also makes it so that you have a much longer protection. So always recommended to get both shots of a 2-dose series.
And what about for the people who've said, oh, well, I had COVID already. Aren't I already immune naturally?
Well, to some degree, you do have some immunity from having a previous COVID infection, but we actually don't know how long that immunity will last, and whether it will protect as well as the vaccine against some of the variants. So again, you want your immune system to have the best possible opportunity to fight off infection. So really recommend that you do get vaccinated.
And how long do you think these vaccines are going to be effective for? Do you think that there will be a booster shot for us later on?
We don't know for sure how long the shots will be effective for. But what we do know is that the studies are ongoing, and that to date, what we've seen up to now, the vaccines are have been very effective over time. So the research is ongoing, and we will see what happens.
What about traveling? I know a lot of people have been just like chomping at the bit to get out of the country, even out of their own community. Do you think we're all going to have to be fully vaccinated if we want to travel in the future?
Well, we recommend that everybody gets fully vaccinated, whether or not you travel. That's the first thing. And, it's a bit of a complicated answer. Right now in BC, there are no restrictions on where you can go, either in the province or across the country. But there are many provinces and countries that do require vaccinations. And so it's really important to check with the place that you're going to make sure that you know what they're going to be needing. And so and then the other part of that is that to come back to Canada, you really do need to check to see. You really do need to check the Health Canada website, which lets you know what you need to get back into the country. So right now, if you have 2 shots, you don't need to quarantine, but you do need to get a test. But things can always change over time.
And what about getting other vaccines around the same time? I know it's summer right now. I keep saying this. Nobody wants to hear me talk about the fall and flu season, but by the time we know it, kids will be back in school, people will be getting sick, and there's going to be a demand for flu shots. Can you if you get your flu shot, can you go the next day and get your COVID shot or any shot around the same time as your vaccination for COVID?
So you're right. No, we don't want to be talking about the fall quite yet. But it is important to think about it. Generally, we recommend that there's about 2 weeks of separation, or at least 2 weeks of separation between your COVID vaccine and other vaccinations. But if you're unsure, always best to check with your vaccine provider.
And there are a whole bunch of different kinds of vaccines. I myself, the first one I got was a Pfizer. And when I went back for the FNHA little community shot clinic that they had, I got, I believe, AstraZeneca. Why are there so many different kinds? Is there a reason behind that?
FNHA has been providing Moderna vaccine in most of its clinic, but sometimes Pfizer as well. There's so many vaccines because researchers, when they first found out, when we all first found out what was causing COVID-19 disease, lots of researchers were started trying to find out or trying to find a vaccine to stop the pandemic. And they, unfortunately, many of those efforts have succeeded, which means that we have a whole variety of safe, effective, and high quality vaccines available to us. This is really important as well, because this also means that supply can ramp up, because we need to vaccinate the whole world for this pandemic to be over. Canada has approved the ones that provide the best and safest protection for Canadians.
What about the virus and its mutations? I know there's the Delta variant right now. Will the vaccines that we have right now still be effective in protecting against the variants?
Yeah. When you have both shots of a Health Canada approved vaccine, you will be well protected against all the variants. However, some of the variants can escape some protection, and that's mostly if you only have one of a 2-dose series. So again, make sure you get both shots, and you can be rest assured you'll have good protection.
A lot of people are just waiting for that time where we have community immunity. With the timeline and the way things are going right now and the numbers, do you think we're going to reach that anytime soon? Or when do you think we're going to get to that community immunity?
Well, we now think that almost everyone who's eligible will need to get vaccinated for us to reach community immunity. So we actually think that this virus will be around and we'll be living with it. So because of that, it means that if you haven't been vaccinated, that you will continue to be at risk. So we encourage everybody to get vaccinated and to get both shots of those vaccines.
Some people can't be vaccinated. For example, children 12 and under. When do you think they're going to be eligible to get these vaccines?
We do know that lots of studies are going on right now. The work is being done to make sure that there are safe, effective vaccines for the under 12s as well. We will need to have children vaccinated as well if we are going to reach that, opportunity where less virus is circulating in communities, and that we can, keep it mostly at bay.
And I wanted to ask this question for people that might have previous health conditions or chronic issues. Should they be talking to their doctors before they just go ahead and sign up for a shot?
For most conditions, I mean, if you have high blood pressure or diabetes or anything like, you're safe to get vaccinated. There are some conditions, such as people who have some cancers and are on some medications that may interfere with the vaccine, that you really should be checking with your doctor before getting vaccinated.
And I know that this is a big question because people were so sick of wearing masks. If you get 2 vaccinations and it's 2 weeks post your second shot, can you drop the mask?
Getting both shots of the COVID-19 vaccine does provide excellent protection and is absolutely the best way for us to be getting out of this pandemic. At the same time, even when masks are not required, they do still provide an added layer of protection and are a really good habit that we have gotten into. So We do recommend the use, particularly if you are in a crowded place where you can't stay 6 feet away from people, or you're in a crowd of people and you don't know whether people have been vaccinated. So, or if you're in close contact with somebody where the vaccine might not have, be as effective for them. So, such as visiting an elder or those with medical conditions. So in those circumstances, we particularly recommend it. But if you're going for a walk and you're outside, or if you're in a place that isn't very crowded, you don't need to wear a mask.
And final question. It's a more personal question. I know that you are doubly vaccinated, just like myself, but what were your personal reasons for lining up or sitting down and getting those shots?
I think the most important reason for me is because I want to be able to hang out with my dad. He's getting kind of old. I think even he would admit that at this point in time. And he has some health conditions. So I'm really lucky to have him around, and I want it to stay that way for as long as possible.
Great. Thank you so much for being with us here today, Dr. Swinkels. I'm very, very thankful that you could come and kind of break everything down for us, because hopefully we'll get there one day, along with help from people like you and the other doctors that have been participating in Talk to a Doc.
Thank you so much for having me.